Welcome to Health Talk. I'm Dr. Manny. It is challenging to diagnose ovarian cancer in its early stage. That's why it is one of the most deadly types of cancer. The World Health Organization says at least 1/3 of all cancer cases can be prevented. You just need to know the signs. Joining me now is Louisa McGregor from the Ovarian Cancer Foundation. She's also battling ovarian cancer. She's here with her sister Pamela Esposito. They co-founded the non-profit T.E.A.L walk, which stands for Tell Every Amazing Lady. Thank you both for coming. Now, I'm an OBGYN. I know how difficult it is to make the early diagnosis of ovarian cancer. In your case, how was it made and what kind of symptoms did you have?
My diagnosis was made after surgery. The symptoms that I had was pelvic pain, lower back pain. When I look back on it now, I had frequent urination but didn't realize it.
So, you used to go to your gynecologist on a regular basis?
Yes. I had endometriosis, so I was being carefully watched by my doctor.
So what happened after you had surgery?
I had a total hysterectomy.
And then what was the game plan afterwards?
The game plan after that was to start chemotherapy.
Now, you decided to bring awareness into this, to tell women about ovarian cancer because it must have been a shock to you, So you brought your sister along and you formed this organization to bring awareness. Tell me how, you guys did that.
I was actually laying in a hospital bed and said to myself, I'm going to do one of those walks for ovarian cancer. There's walks for all types of cancers. I'll find one for ovarian. When I came out of the hospital, it was very hard to find. I didn't find anything in the New York area.
How does a family cope with that, and what would you tell other families that are going through the same thing?
There's a couple of things. We all act as sort of support system. I think it's really important to surround yourself with positive energy, positive people, and when she's making decisions about doctors and treatments, we would always be there to help her, put ourselves in her shoes. Would we do the same thing in that position and sort of be her cheerleader? You're doing the right thing, or why don't you try this? And there's ovarian cancer in the family.
Right.
There wasn't previously that we're aware of. So it's really important that I'm doing screening myself too, and for other family members who are women in the family, we've let them know, hey, make sure that you're getting some screenings, and you're not getting checked when you get a pap smear at your gynecologist. As I'm sure you know, like Louisa said, it was caught with CA125 test, that you should ask your doctors for that, and also internal pelvic sonograms. There's really no specific test for it, but those things really help.
So the purpose of this walk, of this organization, is to say to women what? Think about ovarian cancer, because it's there, right?
Right.
And give me the second and third point.
Knowledge is power. They need to be aware of it. They need to know about it.
Awareness,
Yeah.
recognizing signs and symptoms,
Yes.
right?
Don't ignore the signs.
Which could be
persistent
very
signs.
subtle. And also, what are at least some of the tests that could help you pick up, which is what you mentioned, which is a blood test called CA125 and a pelvic ultrasound. And, once you have somebody in your family, especially older women in the family should be checked out. For more on the organization, visit tealwalk.org. That's it for Health Talk. I'm Dr. Manny. Thanks for watching.